So, today we're going to discuss another popular topic, Parkinson's disease. And a lot of people have asked for this to be reviewed. So here we go. Parkinson's disease is classified as a neurodegenerative disease. There are many other diseases in this category, such as Alzheimer's disease, Lou Gehrig's disease, Huntington's disease, and others. But all of these share something in common, that parts of the brain or the nervous system suffer from nerve cell degeneration or neuron breakdown at an accelerated rate. In this case, the part of the brain that's mostly affected is involved with the control of movement. Takes place in what's called the midbrain, and even more specifically, in the group of cells that make up the substantia nigra. It can be considered an imbalance between the actions of two neurotransmitters, dopamine and acetylcholine. There are a good number of symptoms that result from this process, involving movement to speech to cognition, a whole range of different problems. One of the first symptoms to be noticed is often the onset of tremors or shaking. In fact, an older name for Parkinson's disease was shaking palsy. Initially, it can be a slight tremor of the hands or the head, which can be quite subtle, but eventually deteriorates into a very noticeable shaking, which cannot be controlled. Further down the road is a noticeable slowing down of movement, something we refer to as bradykinesia. Brady means slow in Latin. Also apparent is a rigidity or stiffening of movement. This can even be tested by physical exam, where the doctor tries to move the patient's joints but encounters involuntary resistance. This rigidity can lead to problems in balance, or what we call postural instability. And all of this will eventually lead to walking abnormality, where a typical shuffling gait is observed. The patient moves with very small, shuffled steps to move along. And an unfortunate long-term consequence is the effect that Parkinson's has on the rest of the brain over time. Depression, anxiety, full-blown cognitive impairment, these may appear after years. These, in fact, may be the most distressing symptoms to arrive. So here we see a cross-section of the brain, pointing out to specific areas that are affected by Parkinson's. We see that little area called the substantia nigra, where dopamine pathways deteriorate over time, causing these problems. Here we focus on the actual synapse where dopamine is transmitted. We see on top a normal synapse. This is the way nerve cells communicate with each other, where sufficient dopamine crosses from one neuron to another adequately. Below it is a synapse affected by Parkinson's. Much less dopamine is available for transmission, with a resultant movement disorder. So why does this happen? Well, there are several reasons that this may come into play. One, of course, is a person's genetics. You may just inherit faulty genes from your parent that leads to dopamine loss. But there are other reasons other than just genetics. There are many toxins that may result in Parkinson's, aluminum, iron, other heavy metals that have been shown to be involved. So many other pollutants and poisons in our environment can cause the same. Certain viral infections can cause it. Even repeated trauma, repeated blows to the head can cause Parkinson's disease. This is something we call Parkinson's pugilistica or fighter's Parkinson, as seen in the famous boxer Muhammad Ali. And many other famous people who suffer from Parkinson's, Michael J. Fox, Alan Alda, Ozzy Osbourne, all of these guys have Parkinson's disease. So where does free radical damage fit in here? Where does oxidative stress fit in here? Where does glutathione fit in here? We can go back to 1991 when researchers noted that free radical damage was a clear factor in the development of Parkinson's disease. This article reviews the role of lipid peroxidation, iron, which is a heavy metal, catalase, another antioxidant, superoxide dismutase, another antioxidant, and of course, glutathione, the master antioxidant. They included over 90 other references to validate their viewpoint that oxidative stress and free radical damage are involved. Finally, the role of glutathione depletion was a major part of the pathogenesis of Parkinson's. And still, as far back as 1991, it was found that brain levels of glutathione could be as low as 2% of normal. 2%, that is really dramatic. Again, these findings are over 30 years old. But glutathione and its role in Parkinson's is still being extensively examined. There are still questions about whether the loss of glutathione is a cause or a result of the disease. But we're getting closer to an answer. A more important consideration is whether raising glutathione will positively affect the outcome. This, as you'll see, has been answered. In this recent study, scientists were interested in following glutathione levels in very early Parkinson's patients, what we call prodromal Parkinson's. They found that this, in fact, was detectable very early in the disease. In fact, they suggested that measuring glutathione could be a potential screening tool for the development of Parkinson's disease. So this alone is a very important finding. Now, in the past few years, scientists have been able to determine glutathione actively in living brains. Here they used state-of-the-art scanning using MR spectroscopy to do this. They were actually able to focus down onto the area of the brain most affected in Parkinson's, an area, as we mentioned before, the substantia nigra. And what they found was an increase in iron toxicity and a substantial decrease in glutathione. So now we can prove this at brain levels without having to do a biopsy or an autopsy, another major advance in our technology. So getting back to some basic things that we are clear about, notably the role of dopamine in Parkinson's. Here, researchers discuss that dopamine depletion, which is a well-established phenomenon of Parkinson's disease, this depletion increases as the brain ages. In the study, they more importantly note that glutathione also falls as we age. So what do you do with this information? They were able to correlate the degree of dopamine loss with the severity of glutathione depletion. In other words, the loss of dopamine correlated perfectly with the loss of glutathione. And just to review, dopamine depletion is responsible in the pathophysiology of Parkinson's. So the major treatment of Parkinson's is giving different forms of medication to reestablish normal dopamine levels. The problem is that dopamine itself has some toxicity, and that after a number of years, the dopamine supplementation actually damages the cells involved. This is why dopamine therapy wears off after a few years. This is a clear problem. And what these researchers found was that elevating glutathione can actually offer some protection from dopamine toxicity. In other words, dopamine therapy can be continued for longer using this approach of raising glutathione. A very, very important finding. And taking advantage of another progress in technology, scientists have really recently become more and more adept at determining genetic abnormalities. And certainly, glutathione gene abnormalities are increasingly being examined. It's now clear that individuals with certain glutathione gene aberrations are at increased risk of developing Parkinson's disease. So soon we'll be able to screen for risk even at birth. You'll likely see these types of technologies being done routinely in the near future. So getting back to the critical question, will raising glutathione levels help here? Back in 2008, this question was pushed to the forefront. And neurologists questioned why glutathione replenishment was not more actively pursued in the treatment of Parkinson's disease. They call this the elephant in the room. I'm not sure how well this translates into Spanish or French, but essentially it means, why isn't anybody talking about what should be so obvious? Good question. So this stimulated much research looking at the use of antioxidants in the treatment of Parkinson's and Alzheimer's as well. In the words of this research team, antioxidant treatment is a promising avenue in neurodegenerative disease therapy. They called for an acceleration of this research, which had been shown to be so promising in animal models. Clearly, raising glutathione has significant potential. In this early Italian study, researchers injected intravenous glutathione in early Parkinson's patients. They injected them twice a day for a month, and it worked. A 40% improvement in symptoms was demonstrated. However, the patients fell back to their baseline functioning very quickly. They fell back to their baseline functioning. So let's take a look at this. Let me show you a video of the effects of intravenous glutathione on Parkinson's. I hope this works. So here we see the patient at the doctor's office. He's been asked to walk up and down the corridor. We see the typical walk that Parkinson's patients display great difficulty. Then the patient receives the intravenous glutathione. Now, look at the dramatic improvement. Just remarkable. Just incredible. The problem is that the patient returned back to his usual disability by the time he got home. Yes, by the time he got back home, his symptoms returned. This is because the half-life of intravenous glutathione is literally measured in minutes. You heard me right. The half-life of intravenous glutathione is measured in minutes. But nevertheless, this shows the enormous potential of glutathione. So what if we were able to raise glutathione in a more sustained way so that it doesn't wear off as fast as intravenously. Well, the drug that is most used by the medical profession to raise glutathione is NAC, or N-acetylcysteine. This is a very effective way to raise glutathione, but does have a number of problems, including some real adverse effects. Again, a clear call for research to pursue a course of action that is screaming to get done. To date, however, the use of NAC has shown only mixed results, no clear-cut answer. What has been shown is that NAC can correct to a certain degree the loss of dopamine in these subjects. In this double-blind study, patients received either NAC or placebo for 3 months. And dopamine receptors were then looked at by special brain scanning. They reported a significant improvement in the dopamine system, calling for studies to look at clinical improvements as well. In this study, intravenous NAC was used, and it clearly showed increases in both brain and blood levels of glutathione in the patients examined. So as we've discussed in previous networks, the amino acid cysteine is the major precursor of glutathione. The important thing to note is that cysteine needs to be supplied in a biologically active form. Regular plain old cysteine doesn't seem to work. This is why doctors use N-acetylcysteine and other compounds. So there's active research going on to look at different cysteine delivery methods to improve glutathione levels, in particular in Parkinson's disease. Immunotec is one such cysteine delivery vehicles. Dr. Daniel Linsman has been working with Immunotec for years now. Now, way back in 2017, he published an article on the use of Immunotec, describing it as a way to provide what he terms neuroprotection from different forms of brain challenges induced by oxidative stress or free radical formation. And the mechanism by which it worked was, as we know, by raising glutathione. Finally, this study done in Thailand used Immunotec in a double-blind, randomized, placebo-controlled study looking at Parkinson's disease patients. As expected, glutathione levels were significantly elevated using Immunotec, and several other biochemical improvements were also noted. So, to summarize, free radical damage and oxidative stress are very evident in Parkinson's disease. You can see a drop in glutathione levels even at very early stages in the disease process. Glutathione drops over time and can be correlated with the severity of the disease. People with glutathione gene abnormalities are more susceptible to the development of Parkinson's disease. Raising glutathione levels has been shown to preserve dopamine activity. And finally, raising glutathione levels has been shown to be a promising strategy. So, thank you very much